I'm Alexis Diamond, Associate at Vantage Technology Consulting Group, and the lead consultant on this research project, Project Heroe. I'm here to talk to you about the project and my involvement and what I think makes this project really special. Project Heroe is a modular state-of-the-art healthcare facility that can quickly be deployed at a potential contagion epicenter to prevent a serious outbreak before it can build momentum and become a pandemic. The project was the brainchild of David Schwartz, a principal at the internationally recognized architecture firm HLW. David worked with the USC School of Architecture and Keck School of Medicine to build a team of advisors and experts for this groundbreaking project. The project recruited 6 students from the USC School of Architecture to help develop the ideas and concepts. And the whole thing came together in just 90 days, issuing the report at the end of July. Designed around modular containers, Project Heroe can quickly be deployed in environments ranging from inner cities to rural countrysides. The project's facility includes patient rooms, treatment rooms, staff housing, intake and triage, and support spaces. As a self-contained facility equally at home in downtown San Francisco and rural South Dakota, staffed by skilled epidemiologists, clinicians, and care team members, Project Heroe can quickly intake, triage, and treat an infected population, reducing the spread of contagion, which can prevent significant loss of life and economic downturn shown in previous pandemics. While it will take a big investment to create Project Heroe's facilities, preventing the next pandemic will be worth much more in terms of human life and the impact to the communities around the globe. As a graduate of the USC School of Architecture, the highlight of my involvement was being part of the charrette and being able to see and talk through some of the ideas with the students and the other advisors. It was a really great way to reconnect with my alma mater. Many of the current solutions we're seeing have focused on how to mitigate the coronavirus by planning measures to flatten the curve, reduce the spread of infection, and manage our scarce resources. However, the Project Heroe team is taking a much more aggressive and proactive approach, which gives us the opportunity to be a game changer with regarding the future of pandemics and other catastrophic events. Project Heroe is designed to be quickly deployed at the site of a potential outbreak before it has a chance to spread. If we can stop a contagious virus before it gets going, then we don't need to put in place the limitations that we're living in now. Think about in the last 6 months, how it would have been different if we would have deployed Project Heroe when the outbreak was detected. Vantage is the healthcare technology and workflow advisor providing technology-focused consultation, ideas, and feedback to the team. We work with leading healthcare providers across the country and overseas, from world-class organizations like Sutter Health and Cedars-Sinai to cutting-edge academic medical centers such as NYU, The Ohio State University, and the University of California, as well as small community hospitals. We're helping these healthcare providers plan for their future with strategic planning, technology visioning, and master planning, making Project Heroe a perfect fit for us. I was Vantage's lead consultant for the project. I was responsible for brainstorming how technology can be deployed to support Project Heroe's mission, providing advice, feedback, and recommendations to the students and research team, and writing Vantage's contribution to the final Project Heroe report. Some of the technologies we discussed included real-time location systems, facilities operational command center, robotic and drone delivery, and much more. So I think the big takeaways and some of our key contributions on Project Heroe were around real-time location systems, the project's virtual deployment, and the ideas behind just-in-time supply. Looking at RTLS, for example, or real-time location systems, this system allows you to monitor and track all of the elements within a facility, usually including expensive equipment and life-saving devices, but can also include things like key staff members, patients, visitors, and even lab specimens, medications, and supplies. By tracking all of these things, you not only get to track some of the potential contacts of potential exposures, but you also get to start to optimize and sometimes automate some of the workflows and processes. For example, a clinical staff member could come and use the last linen out of a clean supply room. The building would automatically request additional linens, knowing she's used the last one. This would eliminate a low-value manual task that's normally used. One of the other things that we began to talk about is the idea of just-in-time delivery technologies. One of the issues that comes with the ideas behind Project Heroe is storage space and the inability to have an abundance of it. This requires us to start to think about ways of having just-in-time delivery or just-in-time supplies. Looking at drones or 3D printers can be a great solution for this problem. Thinking about if you need a medication or you need a certain type of supply, having a 3D printer that is able to create the things that you need when you need them, rather than having a large supply for the next couple of months, allows you to have more optimized space. Drone delivery really becomes a big game changer in some of these areas, like the urban places where we may have to string out a program or pull the storage space away from the patient care areas. Drone delivery would allow us to take those supplies and move them quickly between one program and another, or even take specimens or tests from one spot to another. So we're able to actually pull out and reach out with some of those programs like triage and treatment away from maybe the bigger programs like surgery and especially storage. We also talked a lot about the virtual deployment of Project Heroe. When Project Heroe is deployed into an area, there would also be a virtual component. This would extend the healing umbrella of the project into the community. We would have an app or web-based portal that would allow the extension of information and medical support from that building into the surrounding community. Some of the information we'd be talking about is things like notifications, locations, directions, and timelines of things that we've been craving in this time with coronavirus.